Hello everyone. Today I am going to discuss an interesting topic, and that is endometriosis and allo-immune rejection of pregnancy. I am Dr. Mohan Rao. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology, in different cities of India. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using immunological treatments, including lymphocyte immunization therapy or Immulit and other immunomodulatory medication. So let us begin with today's topic, and that is endometriosis and infertility. Initially, I will discuss a little more about endometriosis. As you all know, endometriosis is a common gynecological disorder affecting at least 10% of women in the reproductive age group. It is an immunological, hormonal, inflammatory disorder characterized by the growth of endometrial tissue outside the uterine cavity. Endometriosis is very commonly associated with pelvic pain and impaired fertility. Now, coming to the physiology of endometriosis. The exact cause of endometriosis is still not clear, but it has been shown to have multifactorial origin. And there are various theories that are put forward. The first and the oldest theory is Sampson's theory of retrograde menstruation. And this theory proposes that viable endometrial tissue is disseminated into the peritoneal cavity via the fallopian tubes during the menstruation, and it subsequently implants into the peritoneal cavity and other organs. The second theory is the theory of coelomic metaplasia. Now, according to this theory, endometriosis arises from the metaplasia of cells lining the peritoneum following hormonal, infectious, or even environmental stimuli. The third theory is embryonic rest theory. Now, according to this theory, endometriosis arises from cells remaining from the Mullerian duct migration during embryonic development and followed by estrogenic stimulus. The fourth theory is stem cell theory. According to this theory, endometrial stem cells from the basalis layer of endometrium can travel by retrograde menstruation or through lymphatics or even through blood vessels into the peritoneal cavity and develop into endometriotic lesion. And the fifth theory is altered utopic endometrium in endometriosis. The normal or utopic endometrium in women with endometriosis is significantly different from that of normal women. And this can be due to inherited or acquired genetic factors. So now let's come to the immunopathology behind the disease of endometriosis. It is now clear that immune system plays a very important role in the pathogenesis as well as progress of this disease. Immune cells appear to be the key factors in the development of this disease. The woman that develops endometriosis has a defective immune system that is unable to recognize and properly mount an immunological response to those endometrial fragments within the peritoneal cavity. And this is controlled by complex immunological mechanisms involving both innate as well as adaptive immunity. Now we will see what is the role of immunosurveillance in endometriosis. Very important to understand. The phenomena of retrograde menstruation, as I had mentioned in the Sampson's theory, has been thought to be responsible for the development of endometriosis. However, this retrograde menstruation occurs in many women, especially those who are in childbearing age group and have irregular periods. This can happen regularly, but not all of them develop this disease. Once the endometrial tissue reaches the peritoneal cavity, it does not get implanted in healthy women and it is eliminated through a system which is also called as immunosurveillance. and this is achieved using the process of apoptosis. The exact mechanism of immune surveillance evasion in case of endometriosis is still not clear, but immune system abnormalities play a major role in that. So next we will see the role of immune cells in endometriosis. The peritoneal fluid contains different types of immune cells. In endometriosis, the number of these cells and their function is dysregulated. First, let's take macrophages. In endometriosis, in spite of activation, the phagocytic activity of macrophages is actually gone down and they fail to eliminate the endometrial ectopic tissue. There are two types of macrophages, M1 and M2. Now the M1 macrophages, they are important or they specialize in elimination of defective cells through inflammatory cytokines. While the M2 macrophages, they promote angiogenesis and tissue repair. So in endometriosis, there is an excess of M2 macrophages in the ectopic endometrium, and this plays a very important key role in the development and persistence of endometriotic implants. So it is this M2 macrophages. And what about natural killer cells? Yes, you know that NK cells are the lymphocytes of innate immune system, and they can distinguish and kill stressed cells that have undergone injury. Now in endometriosis, the ectopic endometrial cells in the peritoneal cavity are not targeted or not removed by NK cells through the mechanism called as immune escaping. These cells, endometriotic cells, escape this effect of NK cells. In case of dendritic cells, it has been shown that the number of mature dendritic cells also significantly goes down in cases of endometriosis, and this leads to masking of the endometrial antigens in the ectopic endometrial tissue by the circulating and endometrial antibodies. And due to this, endometrial antigens are not effectively recognized and ectopic endometrium continues to grow. So this is a complex immunological mechanism responsible for that. And now what is the role of cytokines in endometriosis? Let's hear more about that. Now cytokines, are the main mediators and communicators of immune system. The immune dysregulation is an important aspect of pathogenesis of endometriosis, as I have told you before. So the peritoneal fluid of women with endometriosis contains very high concentration of pro-inflammatory and angiogenic cytokines. So what happens is the important inflammatory cytokines that are raised in the peritoneal fluid of endometriosis are mainly IL-1, TNF-alpha, and IL-6, and they produce this inflammatory effect. While IL-10, which is an anti-inflammatory cytokine, is interestingly also found in high concentration in endometriosis, and this increased concentration of IL-10 leads to decreased cytotoxicity of NK cells for the endometriotic implants, and so this cytokine dysregulation is an important aspect of pathogenesis in case of endometriosis. The peritoneal fluid of women of endometriosis contains all these cytokines which I mentioned, which are pro-inflammatory and angiogenic, which are responsible for the immunological effects. Now let us see, is there any association between endometriosis and autoimmunity? Now there are many studies that have been proposed that women suffering from endometriosis have immune associated disorder, and there is an association between endometriosis and autoimmune disease. There is now evidence of increased levels of a range of autoantibodies in women who have endometriosis. However, it is still not very clear whether endometriosis is the risk factor or is a consequence of autoimmune disease, or maybe both these disorders, endometriosis and autoimmunity, share same pathological mechanism and pathways. So that's about autoimmunity. Now let's come to endometriosis and infertility, the most important part. Now endometriosis is very commonly associated with infertility. The inflammatory environment of endometriosis is detrimental to pregnancy, and there are many immunological factors in endometriosis that lead to infertility. The first one is endometrial CD57 positive cells. Now, it is known that endometriosis is commonly associated with CD57 positive endometrial NK cells. The CD56 positive cells in endometrium maturate into CD57 cells, and these cells are cytotoxic and they are responsible for recurrent implantation failures, which is commonly seen with endometriosis. Estimation of CD57 cells in endometrium can be done using immunohistochemistry by doing a luteal phase endometrial biopsy in patients with endometriosis with associated infertility. There is also increase in inflammatory cytokine TNF alpha in case of endometriosis, which is also responsible for implantation failures or miscarriage. In fact, the recent research has shown that the expression of natural cytotoxicity inhibitor or NCR NKP46 on the NK cells is reduced in RPL and RIF, and in endometriosis also the expression of NKP46 in the peritoneal fluid NK cells is significantly low. So this indicates that there is a strong association of endometriosis with recurrent pregnancy loss or RIF. These patients can be effectively treated by immunomodulatory treatments. This includes lymphocyte immunization therapy, that is Immulit, which is an active immunomodulatory treatment. It reduces the NK cell activity, leads to reduction of TNF alpha levels and rise in T regulatory cells. Lymphocyte immunization therapy or Immulit can be complemented by use of passive immunomodulatory medications which are given after the Immulit procedure. So in conclusion, endometriosis is an inflammatory disease with a strong immunological basis. It is associated with abnormalities of immune system involving immune cells, cytokines, and chemokines. The endometrial tissue grows at ectopic sites due to the phenomenon called as escape of immunosurveillance. Endometriosis shares many features of an autoimmune disease, but it is still unclear whether endometrium is the cause or it is endometriosis is the cause or the effect of autoimmune disorder. Endometriosis is commonly associated with infertility due to immune dysregulation, and therefore immunomodulatory treatment of lymphocyte immunization therapy or Immulit can be beneficial in those cases of endometriosis and followed by use of passive immunomodulatory medications. So if you like this video, please share it with your friends or those who require it. There will be someone who is looking for this information. And I am thank you for listening to me in this for this live presentation. Thank you so much.